Today's Mandela Day, and to mark the moment, doctors and medical staff embarked on a surgical marathon to treat 700 patients on waiting lists for surgeries at Gauteng hospitals. This was also intended to heed the call to action from the Nelson Mandela Foundation under the theme, "The Legacy Lives On Through You." According to the Gauteng Department of Health, the province started the year with a backlog of over 32,000 patients awaiting surgical procedures, and that number is now reduced to 18,000. MEC Nomantu Nkomo-Ralehoko joins Full View now. MEC, good evening to you and welcome. I'm sure it was an incredibly welcome initiative for those patients who've possibly been waiting for some time to get those surgeries done. Just talk to us about how it all came together.
You are right. They were so excited and happy about the surgeries that they managed to do, especially those Kokos from Tembisa that I met this morning. They were singing. They even formed a choir. They didn't know each other, but immediately when they were coming out of the theater, they were all singing with excitement. But it did happen. We thought it's not going to be easy. Indeed, the planning that we had to put through, including with the team, the clinicians, everyone that was involved in this process, because it's not only clinicians that must be involved, including porters, everybody, the cleaners in the theaters. They did so much work. In fact, we are still sitting now in the dashboard, getting numbers that are tripling in. And part of those who are sitting now almost at 635 of the surgeons that we have done, but we have not closed. We will close at 7 o'clock because we started this morning at 6 o'clock when we opened our theaters. It's quite a good work that we have done as the Gauteng province. I'm sure because it's not the last. Quarterly, we will have this marathon, but besides the marathons, we will still continue with the work of making sure that we deal with the surgical backlog in the province.
I was going to actually ask you, about whether this is a kind of initiative that you can repeat to make a significant dent in the backlog. Just share with us, MEC, what types of surgeries were done?
Part of the surgeries that we did, it was the brain surgeries, the knee surgeries, the cataract. I always have a problem of raising that. Arthroplasty, hernia repair, maxillofacial, and hysterotomy, prostate biopsy. So quite a number of them, all those disciplines that we had to do, including cesarean section, circumcision was part of those. So quite a number of almost all the disciplines that we will expect, yeah.
You said at the beginning of our interview, and one can only imagine the level of detailed planning that must go into this, because there are high levels of infection control you have to be mindful of. You've got to have, people in different sectors of the hospital ready to receive the patients when they come out of theatre. How was the selection process done then? Did you try to manage it from a workload perspective, or to just share with us some of the criteria and how the patients were selected?
Yes, we went to the waiting list that we have, because we have a long list of a waiting list of patients that are waiting. So we went straight to that list of those patients that are on the waiting list. We didn't want to overtake other people so that people can complain. So we stick to what we have and make sure that this is what we will start with. Then we can go to the new patients that are coming in. So, because you remember, there will always be people that have been there for years. And if we jump them now when there's this opportunity, that will be a serious problem.
I guess a big problem, the goodwill notwithstanding, is around some of the reasons for such a dramatic backlog. Why is this the case?
It comes from 2020, 2021 and 2022 financial year. You remember, we closed down everything. We're not doing any operations in our hospitals. So hence we end up here. And remember again, Gauteng, it's not only the people that reside in Gauteng that are on the list. It's in the neighboring countries. People are coming from the neighboring countries. People that are coming from the provinces, your Limpopo, your Eastern Cape, your Mpumalanga, Northwest, almost all the provinces, you'll find that there's somebody that comes from those provinces. And we can't push them away. That's why we feel that we must reduce it. Let's make a plan as the department, because that's our responsibility. Nobody else will do that. And we wanted to use the Mandela Day so that other doctors can pledge their support and come on board and assist us. And that's exactly what they did when we announced this. So we started planning all these days. I think 2 weeks back, that was an intense planning then of going from hospitals, aggressive cleaning and aggressive renovation of all our theatres in ensuring that they are operating.
Yeah.
Hence, all the 32 hospitals out of 37 hospitals, especially the academic ones, tertiary ones, the regional hospitals and district hospitals were operating. Then after this, we will definitely finalize those 5 that were unable to get on board because of some major problems that we still need to do, including the employment of our surgeons in some of our hospitals, because some hospitals will find that we have 1 or 2 doctors that are able to perform some of the responsibilities. So this is now the task of us consolidating of the work that we have done and move forward in ensuring that come next round of the marathon, we're on top of issues. But as I've said earlier on, we will still have some hospitals that are continuing with the operations like we've been doing.
Right. MEC, all I can say is, as I let you go, is that when people look at this, that when people, when there's political will, when there's operational capability, a lot of things can get done very quickly. And for people who use the public health service, who are on those waiting lists, can only hope that this type of activity can sustain to the point where it becomes normal and their normal experience when they visit a public hospital. But we can discuss that at a future time. Thank you for your time tonight and for sharing with us the updates of this marathon surgery day here across Gauteng. That was the Gauteng Health MEC, Nomantu Nkomo-Ralehoko.